we will look at borderline personality disorder. Those with borderline have 0 to minimum cognitive empathy, the ability to understand what someone else is thinking, and minimum to high affective empathy, the ability to understand what someone else is feeling. About 70% of the risk for becoming borderline can be explained by genetic factors. To become borderline requires the individual to have some genetic susceptibility in the first place. There is a complex interplay of biological factors, birth trauma, and psychological factors, a depleted internal pot of gold, or in Dr. Chapman's words, an empty love tank. If any individual feels threatened, it is hard to also feel empathy because of the self-protective mode one retreats into. This may be one reason why empathy particularly shuts down in people with borderline, for they can easily feel threatened given their history of insecure attachment and history of abuse or neglect. The hallmark of those with borderline is a constant fear of abandonment, emotional pain and loneliness, mood swings, anger, hatred of others and of themselves, impulsivity, and self-destructive, highly inconsistent behavior. Hall-Strauss summarizes those with borderline's general attitude towards others in the title of his book, I Hate You, Don't Leave Me. They are individuals who simultaneously lash out physically or verbally in what they perceive as self-protection, all the while craving offers of comfort and love from others to soothe them. About 2% of the general population has this personality disorder. BPD affects 5.9% of adults, about 14 million Americans at some time in their life. About 15% of them show up for psychiatric help. Among people who commit suicide, about 33% are borderline. Among those who have borderline in clinics, 70% have attempted suicide, even before arriving at the clinic. And on average, borderline patients attempt suicide at least 3 times in their lives. For this reason, borderlines are said to have the most lethal psychiatric disorder. About 10% of borderlines actually commit suicide, whereas the 90% just threaten or attempt it. And in clinics for those with eating disorders, alcoholism, and/or drug abuse, type B may be present in as many as 50%. Borderlines cannot tolerate being alone. For them, aloneness feels like abandonment. But whoever they are with, borderlines either feel suffocated by someone getting close to them or abandoned by someone being distant from them. They live in an unhealthy, alternating pattern of pushing others away with anger or clinging desperately to them with gratitude and desiring promises to never be left no matter what. Borderlines also tend to think in very black and white ways, so-called splitting, so that people are either all good or all bad. They may start off idealizing you by putting you on a pedestal and complimenting you, but then eventually they will devalue you by seeing you as inherently a bad person with sinister traits. According to the book, The Science of Evil, borderlines are also very manipulative. For example, acting as if they are weak and helpless, or using sexual seduction or threatening suicide to get attention. They are acting out of desperation to get what they crave, the attention and love they feel they never received as children.